Okay, so I'm going to move on to the last and the deepest of all dives here. So this is the Global Fund. I'm very proud of this one. The Global Fund is an offshoot of the UN. It's a private, basically a private fund that's foundation that's designed to fight AIDS, TB, and malaria. We're the first corporate champion. And we came in with an initial contribution of $30 million over 3 years, focused on 6 countries, as I recall. We have Thailand, Philippines, South Africa, Angola, Nigeria, and I think Venezuela. And we developed these local community-based committees, essentially, to evaluate where the best use of not only our money, but the Global Fund match and other resources that they may have could be to help impact eradication of these diseases. And as you can see, now these are not data attributable just to Chevron. This is the Global Fund effort with our contribution included. But you can see 220,000 people in Indonesia completed HIV testing and counseling. Education in HIV/AIDS is such a huge component. 1.6 million young people in South Africa were reached through their AIDS peer education program that was created through one of our projects. 9,000 new smear-positive TB cases were detected in the Philippines and then ultimately treated. 877,000 patients in Angola who are 5 years old and older with confirmed malaria were correctly treated with ACT. And 850,000 Thai youth were reached through the HIV/AIDS preventative programs. And you can see this picture. We have service stations throughout Asia under the brand of Caltex. We have them in parts of Africa, South Africa in particular. We worked with our retail network to distribute these materials. So it was a complete, integrated, enterprise-wide effort to promote education, training. And what I don't have up here is all the bed nets that were distributed, and the medication that was distributed, and so forth. But this gives you an idea of some of the programs that we developed in partnership with international donor organizations and NGOs, and this is an important area for us. We have, we operate in all the countries, all the international countries we operate, for the most part, are touched by one or more of these diseases.